Thank you, Edible Monterey Bay Magazine, for supporting K-Squid 90.7 FM.
KSQD, and it's time now for Talk of the Bay. I'm Rachel Ann Goodman, your host for this evening's program. Today we're taking two segments, very different topics, as we are wont to do on this program. The first one is about a program to get the antidote to fentanyl in the hands of many more people, including doctors, as a way to stem the tide of overdoses, which has plagued our communities. Santa Cruz County and Monterey County are no exceptions. In California alone, there were 21,000 emergency room visits from overdoses from opioids in 1 year alone in 2021. We don't have the data yet for 2022, but just in case we're thinking it's a remote problem in other places, it's not. So what are people doing about that? How are we responding? I'm here with Lisa Cooper. She's CEO of Santa Cruz Surgery Center, and she's here with me to talk about an enterprising new program to make sure everybody possible has these antidotes. And that's called Naloxone, right?
Yes, it is. Yeah.
Okay. Well, welcome. Thank you for being our guest here on Talk of the Bay. You were on the news, on the television news recently, so if people were watching KSBW, they saw your segment. But why don't you tell me a little bit about this project that you're undergoing and why you, a CEO of a surgery center, decided to do this?
Well, thank you. Thanks so much for having me here. I really appreciate this. And it's really been it's been a very exciting project, and I'm very appreciative of our board at Santa Cruz Surgery Center for supporting us, putting this energy towards this. Santa Cruz Surgery Center, we're a partnership, so we're 50% owned by the hospital, Dominican Hospital, and a group of local physicians. And every March, there's a physician day. And so last year, we actually ordered special chocolate, and went around to our doctors that do surgeries or procedures at our center. And then we also gave some out to some of the Dignity Health physicians, who is our partner. This year, I thought about doing something different from a personal situation with our family, and I thought that just how many people have allergies that they keep an EpiPen in their purse. I thought, wouldn't it be nice if there could be more Narcan? That's how you can pronounce it quicker and easier for me, and out there more often.
And what does Narcan do for someone who's overdosing?
So if they're overdosing, it can reverse it. It can reverse it rapidly. And if you don't have any opiates in your system, it has very little effect.
So if someone's passed out from drinking, for example, it's not going to help them, but it won't hurt them either.
It won't hurt them.
But on the chance
that they're lying on the street because of an overdose, which often we see people lying on the street, and you might wonder. And so what we wanted to do is get little first aid kits and put a couple Narcan doses in them. So, and then the physicians, when they're out to dinner or they're out at the park, that they would have it in their trunk, and so that they would be more comfortable than maybe an average person. That said, a 12-year-old can administer it, and they're going to be having a community-wide distribution at Cabrillo College on April 22nd. Your listeners can probably find out more about that later. We could send a link. So it doesn't need to be a physician, but I thought, why not our physicians? They should have it. It should be something that they have, just like they would have an EpiPen if they had an allergy to some foods.
How is it administered?
It's so you can administer by IV or an injection, but this is a nasal spray. And so the segment that you referred to, what was really good, I think, about that segment is that it actually showed how to administer it. So we had our doctor, our medical director, actually administer it to the reporter on live, and had no effect.
Right, because it doesn't do anything if you're not overdosing.
Exactly.
I was shocked by the number of overdoses and why this is so necessary. I heard a recent segment, I believe it was on BBC or NPR, about someone who was an off-duty doctor who saw someone lying in the grass, passed out, and he thought, and he happened to have one of those doses on him and saved the man's life. And that caused him to want to get these, in drugstores and over-the-counter and everywhere possible, so that it's just like an EpiPen, as you said. But I think cost is maybe going to be a barrier from what I heard in that report.
It was interesting because we did try to, there's a state program that you can apply and you can get it for free. And so we did go through the application process, but We didn't hit any of the categories. So actually that's my next project, to try to see how surgery centers can, be one of those categories, because surgery centers are predominantly physician-owned. There's many of them throughout California. We serve Medicare, Medi-Cal patients, and we have a strong program out there to try to minimize opioid use actually during surgery as well, and for post-op. But back to the pricing. So we got denied. And so I went to our nurse that can order the medications. I'm like, well, let's go ahead and order them. And ours was a discount price, and it was something like $140 for 2 doses.
Oh, wow.
So,
not going to be like condoms over the counter where they're 50 cents.
So, I mean, it's great that they are saying, it's going to be now over the counter, but the big question is at what cost? And the people that need it likely, aren't going to be able to afford it. So that's when we reached out to HIP in the Santa Cruz County, and they were able to support us, and because they are part of that program, and through that program they can then give it to different organizations or individuals, like they're going to be doing on April 22nd.
What's HIP, just in case people aren't familiar with the acronym?
So that's the health initiative here, and so I will. I've got to pronounce it right, so let me just go grab it right.
It's not the Health Improvement Project.
Yes, it is the Health Improvement Project. Great. Thank you so much. And so they're the ones that are hosting, along with a couple other organizations, for the April 22nd. And so they helped us with this. And I'd like to go back, though, about that gentleman, though, that passed out, if I could, because I was thinking of something with that. I think a lot of times people think that if the Narcan's there and readily available, are we somehow enabling the addict, right? Are we somehow allowing that addict just to continue to do drugs because they can then take the Narcan? What I would think would be interesting is, I hear the story of the doctor that did it, but I would be wondering what was the story of the addict that got it. Because eventually, sometimes, and often, not always, that saving of that life, that second chance, is what really turns somebody around. And I just would wonder how that one person reacted to a stranger walking by and saving his life. That could have done it. And that's really one of the things that's really motivating me to do this, is to have that kind of outreach, because I think it would have an impact on the addict.
There's a lot of data, in Europe, where they have readily these harm reduction programs where they give out needles, free, clean needles. That's encountered more pushback in this country than you can imagine. The idea that you would be giving out the means to possibly give yourself an overdose, and people don't want it in their neighborhood, etc. But in other countries, there's a lot of data showing that these programs actually work to prevent death. And it is a public health crisis if you look at the numbers. Even if you aren't someone who's taking the drugs yourself, listening right now, let's say you're in the emergency room and there's 5 people overdosing in front of you. You may have to wait 5 hours to get seen, simply because our emergency rooms are getting flooded with people who are doing this to themselves through no intention, I'm sure, of their own. From what I understand, and I'm not super aware of exactly how overdoses happen, but often they think they're taking one thing and it's actually much stronger than they think, right? Because fentanyl's way more powerful than heroin.
Yeah. I just actually spoke to somebody yesterday, and he had lost a friend 3 weeks ago, had used cocaine, but there was fentanyl in it. And so he passed away. And it's just, and the problem is when you are an addict, you can convince yourself that you're not going to take it, and you may not be taking it knowingly.
Right.
And so that's why I think it's important, for high schoolers, and they're just doing this big initiative right now with social media influencers that are doing these different segments out there and trying to encourage teenagers to have it in their glove compartment, because if they're out at a party, they could potentially save one of their friends' lives.
You mentioned an event on April 22nd. Can you describe what the event is, and is it a way that people might be able to get doses of this?
Absolutely. It's just a drive-by event, and it's at Cabrillo College. They can go to the website for the HIP website, which hopefully we can maybe send off to your listeners, or the way to do that.
Yes, we can post this on our website,
That's
ksqd.org, and we can have links there.
Because I have a flyer, then I can share with it what has the details. But so it's just no questions, drive by, and you can get a dose. And so if you're a parent out there, I strongly encourage you, maybe you think your child isn't doing it. Maybe they're not, but maybe they are.
Maybe at some point in the future there'll be bowls of these doses or swabs that you can give people that will have it, the antidote on it when people come to a party or other social occasions, because that's where people are likely to get the drugs in the first place. Yeah,
I mean, and obviously the goal is to get people that are doing drugs and have a problem to get them sober. And so it isn't really a simple solution, as I think we all know, but it's one.
But it's not. It's more than a Band-Aid. It's more like a tourniquet
yeah, exactly.
for people who are dying on the streets. You wrote about your personal connection to this story, and I know that it's hard to tell personal stories on the radio, but I was wondering if you would be willing to talk about your family member and how that led you to this work, in the hopes that perhaps someone listening might also find solace and inspiration in how you decided to approach the problem.
It has been a very challenging past 3 years for our family. I have 6 children. They range in age right now. Got from 11 to 25 and been married for 30 years. We're your typical family, typical going to Tahoe for skiing, and taking summer vacations here in Aptos sometimes. COVID was a tough time. I think COVID was a tough time for a lot of people. It was in April 2020 when we found out that our then 20-year-old son had a drug problem. And so he went to his first rehab in May. We found one that actually is an LGBT one. He came out. It's a cute story, him coming out. He wanted to have a girl sophomore. We knew that some families know, and I was just waiting, and we were excited for the moment. It was after a homecoming game that he had went to, and he's like, "I want this girlfriend to come with us to San Francisco to spend the night for New Year's because his older brother could invite his friends." And I'm like, "Well, you can't invite a girl to be in one room because we would get just one big room." The hotel always knew we did this with our 6 kids, kind of like a Brady Bunch, and so we were going back and forth on this on the drive back to the house, and I just finally said, "Well, unless she's lesbian, it's not going to happen." And he goes, "Well, what if I'm gay?" I'm like, "So this is how it's going to come out." So he was from a home that was very welcoming of his orientation, and so just want to clarify that. You never know. There's a lot of reasons why people end up being a drug addict. Sometimes it's genetic. Sometimes it's just habitual use. People can do it. Sometimes it can be a trauma. But for him, when he had it, that's all we tried to focus on is how to get his help at the best place possible. And so we thought that was it. And it was a great program. I think over the past 3 years, we've found many very, very good programs. I think part of the problem is that we realize that there is no magic bullet. There's no place that is going to stop my son from being an addict. The only person that can keep him well is him. And it's a really, really hard thing to accept. So he went to the first 90 days there, and it was it was terrifying. We found out his drug of choice was meth. I knew nothing about that drug, and nor would I think in our home in Woodside growing up that I was going to have my son encounter meth. Meth is in the colleges. Meth is there in high schools. It's out there. And once you take it once, it's an incredible high, and it's very addicting. And it's the damage that it can do. It just was terrifying, and I can truly understand how that whole saying, one day at a time, comes about, because it's like if I just thought about it too much. But he did really well, and after the 90 days, he went into the sober living, and he seemed to be absorbing the whole program. It was a very controlled, program, going out one day a week. And then the other times was living within the community, and it was then coming into fall, and he was feeling ready to go back to school. And so it was at San Diego, and everything was, Zoom. So he still wanted to go down to San Diego, though, to be close to his friends, because some of them are going to be there. So he found a sober living there. He took the train himself and went there, and we were very proud. And it was about 4 weeks in, and, I don't know if a non-addict can ever truly understand why the addiction wins one day. It just is really hard to understand. But it won one day. He took his backpack, he threw some stuff in it, and he left the sober living. Now, I'm a pretty clever and creative mom, and I had one device that I could still kind of track where he was at. And so I could see a little bit. It looked like somewhere in the woods behind a SCSC building. And so my husband and I jumped in the plane right away because we were going to fix it. So we flew down, and by the time we landed, actually, the locator was off. We found a place. It was like a homeless encampment, it looked like, inside the woods. My husband looked around to try to see if he could find anything of Jack's. He couldn't. We just sat in the car by the sidewalk, just wondering what we're going to do. And then all of a sudden, like magically, we see our son coming with another man. He was there with his boyfriend, who was a drug dealer. And he was a very pleasant drug dealer, smiled and said, "I told you your parents are going to find you." And said, "I assume you want to take him out to lunch?" And we're like, "Yeah, we like to take him out to lunch." So we took him out to lunch. I never forget it. It was a Mexican place. I didn't touch that taco at all. I just looked across at him, and he was high. But he was able to talk to him, and we just pleaded. We begged, like, "Come home. Go back to detox. What are you doing?" And he was like, "No, I'm fine." And he kept going, "I'm safe, Mom. I'm going to work to get my boyfriend off of fentanyl. Because I know how dangerous that is. And so I want to reassure you, he said, that I'm not going to do that. And I'm going to be safe. I'm doing things safe." So we spent the night. We met him for breakfast the next morning. He must have taken some sort of sedative or something. He actually fell asleep almost during the lunch. He got up for a moment then when he woke up, and he went to the bathroom, and I'll never forget, I just started bawling so much that there's this group of 5 ladies that were next to us, and they came over and they just said a prayer. They didn't know what was happening, but they knew it was bad. And so he got back in the car. We had picked up some of his belongings from the sober living. We put them in a plastic bin we had bought at Target. And we dropped him off at the same sidewalk that we saw him and said goodbye. And I have to tell you, I mean, I just wanted to throw him in the car. I wanted to make sure that the doors were locked and just drive straight to Hollywood and say, bring him back to detox, and figure by the time we got there, he'd be in agreement. But luckily, the rehab had gotten us in touch with an eventualist who said, very, very, very bad idea. So what we did instead is we took that flight home, and it was probably the hardest flight we've ever done. Over the next couple months, we tried another intervention. We did a Zoom intervention. We had about 9 people on the Zoom. And we did all the steps that we should have done. And then eventually, like so many people do, he did end up taking opiates. And he overdosed not just once, but he overdosed 3 times. And each of those 3 times, it was Narcan that saved his life. And so it was Narcan that gave him that second chance. It enabled him eventually to go back and get sober, and which he did. And
thank God. I never knew where the story was headed.
Well, unfortunately, that's not the end.
Okay, yeah.
So 18 months, it has ups and downs. Any family knows this is a family addiction. And so it had a lot more ups, but it had some downs. One of the biggest ups was he finally got cognitive well enough to go back to school. And he had, since this time, after a few relapses, he had made his way to this great program in Dallas, and he got accepted to SMU miraculously, because his last quarter, when he had been, doing drugs, he pretty much failed, but all his grades, he's a smart kid. And he was so happy to be back. And again, I don't know why, and I don't think I can ever understand it. But it was about now 5 weeks ago that we got a text in the morning, and it just said, "I'm sorry, I've decided I can't fight this addiction, so I'm going to find a way to live with it." And in this text, he said the exact same things he said to us at that restaurant, looking across, saying, "Don't worry, Mom, Dad, I'm going to be safe. I'm going to stay away from opiates," he said. Somehow thinking meth itself is safe. It's not safe. It kills you. It can kill you in so many different ways. But more than that, the meth can have fentanyl in it, just like it had. And so the situations and what really motivated me is that I can't do anything. I mean, I think about flying to Dallas. There's people there in Dallas. There's experts in Dallas. There's NA meetings or AA meetings. There's churches. There's emergency rooms. There's things that can help him there, and I can't help him there. But when it was coming to Physician Day, I just thought, I'm thinking about my beautiful son right now on the streets. I just thought, I got to do something. And maybe, just maybe, one of these Narcans in one of these bags is going to save somebody else's son, and it's going to give him that chance. And that's really, really helping me. It's really helping me. We haven't heard from him in 3 weeks.
Oh, that must be so hard. So hard. You're listening to Lisa Cooper, and this is K-Squid, KSQD Santa Cruz Community Radio. Trying to take care of our people is way harder than you'd think sometimes. And doctors see it firsthand in the emergency room. That's why this is so important, what you're doing. And, it might seem pat to say that, the best antidote for what ifs and worry is to do something. And, of course, sometimes you realize you can't do anything, and that's the hardest thing in the world. As a mother, I can tell you, and I can see how hard this is. I hope he shows up again very soon.
Thank you.
And this is a great program for everyone in our community, so thank you for that, for being the spark plug to make sure that if people need it, they're going to be able to have access to this antidote to fentanyl overdose that works instantaneously for anybody. So if you saw someone lying on the ground, you could go up there and administer it as, anyone, just like pushing a little plunger down, right?
Exactly.
Yeah.
Exactly.
We have a few minutes more. What do you think this would be like in the future if it expands to become, everyone gets access? What needs to happen for the public health emergency that it is to have a really reasonable response? I know there's many layers to that question, but let's just take the one you're working on, which is getting Narcan out there.
Yeah, so I think getting Narcan out there is great, and I as I made mention, is that when we were talking earlier before the show, is that there's social media influencers out there right now. I think there's nothing from peer to peer, hearing from your peer. So it was after the little segment that went on last night. It was hard. It was hard to watch, and I was here. My family was in Woodside, and my younger son, my 17-year-old son, called me, and I was a little bit tearful. And he was very kind. He said he was proud of me, but then he said something. He says, "How can I help?" And so he's going to volunteer on April 22nd with me. And I think that how can we help is doing these things and doing this awareness. We don't know for how long my son was doing the drugs before it really came to our attention. And I think having these conversations with your kids, having open conversations and not thinking you're the family that's not affected and thinking that you might be, and catching these diseases earlier on, before they get to such drugs as these that are just very addicting and difficult to manage. So if a kid's having a drinking issue and drinking and partying a little bit too much, that's thinking of that's just how they are. It just can't be that way anymore. We now know better, and we know what damaging it can do, and it can lead to other drugs. So I think by having Narcan, and I've heard them saying in like little machines, that you can just get for free.
Like a vending machine.
Like a vending machine. If we could
great.
have them like in the bathrooms and the bars for free, it would be great if there's somebody listening that has a pocket full of money to be able to fund something like that and just have a vending machine in the bars in Santa Cruz, and they were right there for anybody to take, because somebody might, think, be a little nervous. I don't want to go by the drive-by, So it would be nice if there's more ways that people could get it.
Anonymously.
Exactly.
And with that, it reminds me of what was happening in the 90s, late 90s around birth control. And we were one of the hot spots, for teen pregnancy. And this group of teens went out and got condom vending machines for free, actually. They were free. But they, were in bars, they were in high schools, and they were everywhere, like teen centers that teens would go. So if it's available and anonymous, it tends to get adopted much more quickly. So that's a really good one. So anyone listening, in the moment we have before we have to close, would you like to give out any contact information if people are interested in helping make these projects bigger and wants to help out on the 22nd of April?
Yes,
and
yes.
I think that's at Cabrillo College.
Yeah, that is at Cabrillo College. Actually, they don't have a phone number. That'd be a great phone number right now. So if you don't mind, I can go ahead and just give my number, and then I can connect them up. So it's 650-776-3399. Again, this is Lisa Cooper, and the number is 650-776-3399. I can then forward the website and the flyer and get some more information. And also available if there's other families out there that are going through struggles, welcome the opportunity to talk.
Thank you for sharing your story, and I wish all the best for you. You're a very brave and courageous person, and thank you for coming on the radio today to talk about it.
Thank you for having me.